5 people have perished because of preventable and treatable cholera in less than a week at the large general hospital in urban Accra. Authorities at the hospital have, however, been compelled to convert its outpatient department, OPD, into a cholera unit as the filth related to the disease is now overwhelming. Also, Ghana is 5.12 million cedis richer. That is if businessman Alfred Agbeshiwoyome refunds judgment debt he received between 2009 and 2010. This follows a Supreme Court ruling today. My name is Stephen Anti, and this is today's big story. Today's big story is brought to you in association with Nationwide PVC, fabricators and suppliers of high-grade UPVC windows and doors. Now, cholera is an acute diarrhea disease caused by bacteria called Vibrio cholera. The illness can result in a profound and rapidly progressive dehydration and ultimately death. An untreated person may produce about 10 to 20 liters of fecal matter a day with very fatal results. Now, let's start with the large general hospital here in Accra, because over 170 cholera cases cannot be treated there. This is because the hospital has no space for the number of cholera patients it has received so far. In less than a week alone, 5 people died there of cholera, and then prompting a huge concerns over measures the hospital need to take to contain the congestion at its outpatient department, which now serves as a unit of cholera patients. Earlier, there were reports that a number of patients were lying on the benches, while others on their beds with drips on them, as dozens of doctors flood the OPD to attend to them. The administrator of the hospital, Philip Afeti Koto, told Joy News the facility is doing its best to contain the situation. He also revealed that most of the cases they have recorded so far are from Teshi, Nungwa and La communities. But it seems the large general hospital is not the only health facility that is overwhelmed with cholera. The Rich Hospital here in Accra also have its own challenges. We're expecting later on to be joined by our reporter Matilda Bemega, who visited the large general hospital and the Rich Hospitals to give us a fair appreciation of what the situation is there. So at the Rich Hospital today, we saw the situation. We saw ambulances carrying sick people coming in and out, and it is, if you will recall, that the Rich Hospital is receiving expansion of its facilities, and we're hoping as a country that our health system can provide enough resources and facilities at a place like the Rich Hospital to contain this situation. So this is today's big story, and Matilda Bemega is now joining us in the studio now. Matilda.
Steve.
Good evening.
Good evening.
Thanks for joining us. You look good. You must be tired by now. You went to, which places did you go?
I only went to Adabraka Polyclinic, which we call the Rich Hospital. Yeah, that was where I visited.
Okay, I mean, that's the outpatient department of the Rich Hospital. So what's the situation there? What did you observe when you went there?
For Adabraka Polyclinic, I would say that the number is quite alarming. For just to within, they have recorded a number, like so far, as at the time I was leaving the visuals that road, you saw that 2 patients had just been reported to the facility. Within June, as to date, as we speak, they have recorded about 202 cases so far.
That's serious.
With no deaths yet.
Okay, no deaths yet at the Rich Hospital.
At the Rich Hospital. But the officials there say the number is quite alarming as compared to last year's cases.
And beyond the numbers, I mean, beyond the numbers and the fact that today it wasn't as alarming as it was at the large general hospital, that 2 people were brought in whilst you were there, and a lot more were coming in and going. But beyond the numbers, what were the doctors saying? What's causing this outbreak situation in the capital?
Well, it all boils down to insanitary conditions within the capital, mainly because of these heavy downpour about 2 weeks ago, which was so continuous. This is what has given birth to some of these cases we are seeing today. With already we have issues with sanitation, with a pile up of garbage.
Uncollected garbage everywhere in the
stations,
city.
everywhere you pass, you can see this. So this is what is really causing more of these outbreaks. And officials are worried that this is not just a medical affair. It has to do with every sector
should get
a role
involved.
to play in this particular
the health
issue.
Ministry and us citizens as well.
Particularly the AME have to see to the sanitation issues, because this is what is giving rise to some of these issues that we are talking about.
Are the authorities there expecting it to get worse?
Yes, that is if sanitation issues do not improve within the next few days. If it doesn't, the cases will definitely rise up, because sanitation is what is giving birth to all these issues that we are seeing. So if these sanitation issues do not improve within a particular period, then we should expect that the numbers should keep increasing as the day goes by.
I know you haven't visited the Tema area. You live there. Have you been hearing, gathering reports that this situation could be trickling down to Tema area as well?
For Tema, so far, it's 2 cases that has been reported. It's quite on a better note. Exactly, as compared to what we are seeing within Accra, particularly within the Accra sub-metro, which has over 608 so far, with 15 deaths.
That's very bad.
Yes.
Matilda Vemega, we're very grateful for your time, and thanks very much. Matilda Vemega is our reporter who visited the Rich Hospital outpatient department at the Adabraka Polyclinic, gave us an update now. We're joined on the line now by Director of Health Services, Greater Accra Region, Dr. Linda Van Otu, who is equally worried about the situation at La General Hospital. Thanks, Doc, and we're grateful that you could join us. Apart from worrying, what are you doing to deal with the situation?
Can you repeat that? You said apart from...
I'm saying that apart from worrying, I mean, we are told that you are very concerned about the situation at the La General Hospital, but apart from being concerned, what are you doing to address the situation? Well, I think we're having terrible feedback from Dr. Van Otu, and we're trying to raise her back on the telephone line and hope that we will get a very good reception. So if you just joined us, this is today's big story, and today we're talking about what appears to be a crisis on our hand, where at the La General Hospital, several patients have been turned away because the hospital is not able to treat them, because they don't have the facility and the space to treat them. 5 people already have died, and as you heard the narrative from our reporter Matilda Vemega, the situation at the Rich Hospital is not any better. We're told that 2 people, there have been no recorded deaths there at the Rich Hospital yet, but the numbers have been staggering.
That in cholera management, you don't need any special equipment. Apart from maybe when we get in there, you see that we have beds with hole in it.
I saw it.
And a bucket under it. The treatment is merely replacing the fluids, because the whole cholera is about somebody having profuse diarrhea or watery stools, let me put it that way, and then losing water very fast, so it becomes dehydrated. We actually warn the public about it, because it has become like a ritual. Every rainy season in Ghana now, we get cholera outbreak, especially in Greater Accra. Previous years, maybe let me just go back a bit. When you look at 2011, we had 9,000 plus cases. And then 2012, it came down to 6,000 plus. Surprisingly, last year, it was quiet. Virtually no case, let me put it that way. Then this year, suddenly, cases have started coming up.
Well, we can now attempt again to speak to the Greater Accra Regional Director of Health Services, Dr. Linda Van Otu. Dr. Van Otu, you say that you are worried, and I asked earlier, apart from being worried, what contingency measures are you putting in place at the Health Directorate in Greater Accra to deal with the situation?
Thank you very much. Let me first of all say good evening to all the listeners, and also to thank you for asking us to talk about cholera and what we can do. First of all, we would want to share our condolences with those who have lost family members because of cholera, and also to thank everybody who has supported to ensure that not so many people have died, although we have lost some, which is something we did not want to happen. But cholera is something that goes beyond just the health department. It is something that everybody should be concerned about, right from the home to us in the health facility. Because if you look at how people become infected, it's basically like you have eaten something, food or drank water that has feces in it. So it comes back to the individual and what that person would do to prevent himself from becoming infected. And this is where we've talked about the hand washing and proper disposal of waste, including human waste, and then also the eating of food that is hot. This is where it goes beyond us and gets to those who sell food, or those who sell water, those who sell things for people to buy and eat. That is very important that they keep those things clean, away from flies that can settle on the food, and then for the food that you have to cook and eat, to sell food that is hot, because that will help to kill the organism.
Yeah, but Doc, let me interrupt you a bit. I mean, this is something you said last year. You're saying it again. It means that every now and then the same situation is happening, and you are telling us that the public is enough. Public awareness is key. Aren't people aware of cholera? And why do we keep having the recurrence?
You see, that's why I said that it goes beyond health. For people to ensure that they eat food that is not contaminated in the home or in the community, that's where the community comes in. We in the health sector have to make sure that we've educated the public about what will bring about this disease and how we can prevent ourselves from becoming infected. Again, we have to prepare as healthcare providers to have the logistics, the infusions, the medications to give them, and a place to keep them if they have it. And also to ensure that our own staff do not become infected while they attend to the patient.
And are you doing that? I mean, are you ensuring that this is done?
Yes,
are you doing that?
Yeah.
And may I ask you? Yeah, sure, sorry. Go ahead.
It goes beyond just coming to the hospital. That's what I want to emphasize. If you go into the communities that these cases are coming from, you will understand that it's very important that the community members, the family members, the assembly, all of us get involved. Cholera has been going on for many years, which means that there are some practices that we transfer from us to our younger people, and they also learn and go on and on and on. It is all about keeping ourselves clean. It is all about washing our hands very well before we eat. It is all about washing our hands very well with soap and water after we have visited the toilet. It is about what we eat, making sure that it is hot and not just anything at all. It is about the people who sell the food to ensure that what they are selling to their friends is something that when they take in, they will not fall sick. So it is not just about the health sector. It is about everybody.
Right,
and
Dr. Van Otu,
we need to mount a campaign to ensure that we keep our surroundings clean.
Dr. Van Otu, you said it very clearly. Now, I want you to tell us how you're liaising with the various hospitals to cater for the cholera patients. Let's take, for example, the La Hospital, where over 100 patients are being turned away because the facility is not equipped enough to take care of these people. How are you dealing with that situation?
Let me also explain here that cholera is an infectious disease, and we cannot just mix them up like that. La General Hospital is a general hospital, so all cases come there. Now, with such a disease, what has been done is that they have unknown a place where they can take care of them. And it's important that they keep them isolated so that they don't mix them up with the other people. It is true that where they are is small, and this is because it is not the original thing. That is an infectious disease where we have it solely for people.
But Doc, you're not telling me about solutions. You're just telling me what should be done. But I'm asking you, how are you containing the situation there?
That we have a place now assigned for people who come with diarrhea, vomiting, which is supposed to be cholera, to be managed there, so that we don't mix them up. It is what is happening now. We also have available the infusions that we need to give them. We have the medications that we need to give them. And it's not just at General Hospital. We have all our facilities. And we have camps or places in Adabaka OPD, the Rich OPD, for example, and then in other places. So they know that when somebody comes and is vomiting and has diarrhea, which we believe is cholera, we need to put this person in this place. So those places are there for that to be done. And we have also the protection for the staff. And also we provide water and soap and teach the people who bring the patients so that they don't get infected themselves. So they wash their hands. So provision is made for that.
Dr. Vanotu, we are grateful for your time. We're now joined on the other telephone line by Dr. Irene Ejapong. She is with the Public Health Department of the University of Ghana, Legon. She joins us now. Good evening, ma'am, and thanks for joining us on today's Big Story.
Good evening.
Now, I know you are also worried about you know, this situation. Can you tell me what we are missing? What are we not getting right in dealing with the cholera menace?
Yes, good evening, and thank you for the opportunity. I think Dr. Vanutu has adequately talked about the short-term reactions we are taking to cope. My bigger concern is that as a country, we need to start thinking a bit more medium and long-term. You know, every 2-3 years, we have this cholera crisis. We run around. When it subsides, we all, you know, just let it go. But the underlying fundamental conditions that make cholera a problem for us are still there. You know, and the underlying fundamental conditions are water and sanitation. Cholera is basically, when you get cholera, essentially you have consumed human feces. You may not be aware, but you have. So it is a disease that is tied to poor environmental health practices. And you will bear with me that our cities are terrible. You know, people defecate in the gutters and the open sources of water are suspect. We need as a nation to have a medium to long-term plan. Yes, we are not rich. We cannot do it all at once. But what are we doing progressively? Even if over the last 20 years that cholera has been a problem with us, we have done something every year. Maybe we'll be nearer getting rid of the problem.
So you're suggesting that
band-aid solutions and find real solutions.
You're suggesting that we have no clue what to do. I mean, you were with the Ghana Health Service during your tenure whilst at the Ghana Health Service. What measures did you put in place to arrest the incidence of cholera? Can you share a few with us?
Yeah, I didn't say we have no clue. We actually know exactly what to do. I think we are not doing it. And the problem is that to solve cholera is not, to get rid of cholera, the solution lies with local government. Because cholera is an environmental sanitation problem. And the mandate for environmental sanitation and water is with local government. What we are doing in health is that once the crisis occurs, we try and do something about it. But to prevent the crisis, local government has to be enabled to do something.
Is it not really a shame that lower middle income country like Ghana, people still drink water and there is fecal matter in the water, that basically they are drinking waste in the water? That's a shame, right?
Yeah, I agree with you. It's a shame. And again, it's a solution that requires all of us as Ghanaians. You know, we are too fond of sitting down and saying somebody should do something. Who is that somebody? It's all of us.
Right. So all of us, you would say that all of us, we should start from the local authority, local government levels. Now, let me address one key issue of congestion in the hospitals. If you go to a hospital facility like the La General Hospital and there is congestion and there are cholera cases coming in, greater chance this cholera will reinfect people the more. I mean, people will shake hands, people will lift people, and some will forget to wash their hands, and then they will go back and this goes into their system again. They will drink it again. I mean, what should us as a nation be doing in order to lift off these pressures from hospitals of this nature?
Yeah, I think you've said it all. You know, basically the congestion is a problem. For now, we have another crisis. Immediately in the crisis, I can only say that the hospitals need to be helped to set up, tents and cholera stations to manage the crisis. But on the long term, we also have to deal with this issue of congestion in our public hospitals. In fact, I sit here every day, I pray that Ebola will not find its way into Ghana. I shudder to think what will happen if it finds its way here, given the conditions.
I mean, if we cannot deal with cholera effectively, I beg your pardon, we might not be able to do anything about Ebola. Is that what you're afraid of?
Yeah, because you see, basically, all those diseases have to do with your infection prevention and control practices. And if you have such congested health facilities, it is extremely difficult. And the taps don't only go out in our homes, they also go out in the health facilities. And like I'm saying, this is not a today problem. This is a problem we have sat on as a nation for years. And we need to have a long-term solution that transcends, political parties and change of power. It's a long-term solution that we Ghanaians are implementing and getting to the end of.
Thank you very much. Dr. Japon is with the Public Health Department of the University of Ghana, Legon. She was formerly at the Ghana Health Service.